Before you start taking Epclusa, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Children's dosage is based on age and weight. The manufacturer recommends that children younger than 6 years old take the pellet form of this medication with food to improve taste. If you are using the pellet form, gently shake the packet before use. To take this medication without food, open the packet and pour the pellets directly into your mouth. To prevent a bitter taste, swallow the pellets without chewing. You may drink water after swallowing the pellets if needed. If you are taking this medication with food, open the packets and pour the pellets into a small bowl with non-acidic soft food. After gently mixing, take all of the mixture without chewing within 15 minutes. Take this medication at evenly spaced intervals to keep the amount of drug in your body at a constant level. It is best to take it at the same time each day to help you remember. Continue to take Epclusa for the full length of time prescribed, even if symptoms disappear after a short time. Stopping the medication too early may result in a return of the infection. If you are taking an antacid, make sure to take it at least 4 hours before or 4 hours after this medication. Other acid-lowering medications for indigestion, heartburn, or ulcers may prevent Epclusa from working. Ask your doctor or pharmacist how to use these medications safely. Some common side effects of Epclusa include tiredness, headache, nausea, diarrhea, and difficulty sleeping. If these effects persist or worsen, it's important to inform your doctor or pharmacist. However, many people using this medication do not experience serious side effects. It's important to remember that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of potential side effects. If you experience any serious side effects, such as changes in mood or unusual tiredness, it's crucial to notify your doctor immediately. While a severe allergic reaction to Epclusa is rare, it's important to seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can also call your doctor for medical advice about side effects, or report them to Health Canada. Before taking Epclusa, make sure to inform your doctor or pharmacist about any allergies you may have. Also, discuss your medical history, especially if you have other liver problems or diabetes. If you have diabetes, your blood sugar levels may decrease during hepatitis C treatment, so your doctor may need to adjust your diabetes treatment plan. Be sure to tell your doctor if you experience symptoms of low blood sugar. Before undergoing surgery, let your doctor or dentist know about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to use reliable forms of birth control if you or your partner are using Epclusa with ribavirin, as this combination may harm an unborn baby. Female patients should continue using birth control for 9 months after stopping treatment, and male patients should continue for 6 months. If you or your partner becomes pregnant, let your doctor know immediately. Consult your doctor before using Epclusa during breastfeeding, as it is unclear whether the medication passes into breast milk. It's important to be aware of any potential interactions with other medications when taking Epclusa. This includes both prescription and non-prescription drugs, as well as herbal products. One specific medication that may interact with Epclusa is amiodarone, which can slow down the removal of other medications from your body, affecting how they work. It's also important to note that other medications can affect the removal of Epclusa from your body, potentially impacting how this medication works. Examples of such medications include apalutamide, efavirenz, rifamycins, such as rifampin, rifabutin, St. John's wort, and drugs used to treat seizures, among others. It's crucial to consult with your doctor and pharmacist before starting, stopping, or changing the dosage of any medications while taking Epclusa. And remember, do not take this medication with other products that contain sofosbuvir. Always follow your doctor's guidance and recommendations for the best results. If you suspect an overdose or experience severe symptoms, such as passing out or difficulty breathing, seek immediate medical assistance by calling 911 or your local poison control center. In the US, you can reach the Poison Control Center at 1-800-222-1222, and in Canada, contact a provincial poison control center. Do not share this medication with others. Before starting and during the use of Epclusa, you may need to undergo lab tests to monitor your liver function, as well as tests for hepatitis B and C. It's important to keep all medical and lab appointments. If you are taking Epclusa with ribavirin, female patients or female partners of male patients should take a pregnancy test before starting the medication. Pregnancy tests should continue to be done while using this medication and for some time after it is stopped to ensure no pregnancy occurs, for 9 months for female patients and for 6 months for female partners of male patients. If you forget to take a dose of Epclusa, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to take the medication as prescribed by your healthcare provider. When storing Epclusa, make sure to keep it at room temperature in its original container, away from light and moisture. Keep the pellets in the packets and do not open them until you're ready to use them. It's important to store it in a safe place, away from children and pets, and not in the bathroom. When it comes to disposing of Epclusa, do not flush it down the toilet or pour it into a drain unless instructed. Make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.